So you might ask why I'm talking right now amongst all these very exciting studies looking at treatments. And in part, it's because this is a grant that was funded by FAST and strongly supported by FAST to build an infrastructure so that every child in the world could have the same care for Angelman syndrome. And this is something that's near and dear to my heart in building centers of excellence for rare disease. And this has really started the charge, not just for Angelman syndrome, but for all rare disease, rethinking how we take care of kids with rare disorders and making sure they have access to people who know what they're doing, have heard stories from hundreds of families to try to inform and take the best care of your children. So I'm incredibly thankful to be here. I'm going to take a minute just to talk about community needs and our experience so far. I'm going to talk about the infrastructure and how innovative and exciting this is to have support for, and then how you can get in touch and start using this. So as Allison talked about in her talk, there was a meeting with the FDA, and it was really emphasized that in order to have the most successful clinical trials, we really need to have all kids with rare disease receiving some standard of care to make sure that they're getting the best care possible, so that when anybody enters a clinical trial, at that time, we know that they're getting the same care as anybody else entering the clinical trial. And we really emphasize that we have learned a lot about how to treat Angelman syndrome. So anybody that works with me knows that I'm, one, always available, but two, that we have some data and we know how to take care of Angelman syndrome. And so it's challenging when we hear from families who are so far from that standard of care, and we wanted to make that accessible to everybody. And we wanted to give access, so not just to one provider, but many experts in the field who are all very dedicated to patient care in general. And again, we wanted to create that health equity so that everybody is getting the same care. Everybody has the benefit of the knowledge of all the experts who do have the opportunity to take care of a lot of individuals with Angelman syndrome. And then the next phase of this, and really what's important, is that as providers reach out to us, which have been a lot of trainees, we're also teaching them how to take care of kids with Angelman syndrome. So we're educating the next generation of providers to make sure that everybody's on the same page. So this is our experience to date. So this started July 2021. It was no small feat to get it up and running, and many regulatory meetings, to say the least. And we've gotten calls across the board in many characteristics of Angelman syndrome. I would say by far seizures. But we also hear from families about sleep difficulties and constipation. And one thing that's very unique about Angelman syndrome is that, and many neurodevelopmental disorders, is that you have to be thinking about the whole child anytime you go to treat one particular aspect of Angelman syndrome. So we hear about all these concerns that I've listed, but they all kind of go together at times. And so what we did was we have been working with Ann Anderson and the community to develop a standard of care that hopefully should be available soon. But we've developed all these algorithms, and so what we're doing is actually everybody is practicing the same. So no matter which expert you reach and who's on call at that time, we're all practicing in the same way. And so we have these clinical pathways available, and so we can share those with other experts or other providers in the field and help them become experts. And what we're doing is we're collecting data so that we can prospectively have some data about how that pathway worked for each of your children as you call the line, so that we can hone in on what is really the best practice. So there's a research aspect to this. The biggest barrier is one, I think, awareness. So the culture of rare disease, not just in Angelman syndrome, but many rare disorders, as parent advocacies groups have developed, is to reach out to each other. And one goal of this was to break that pace of things where people always reach out or talk through Facebook. All of us worry about seeing videos of kids having seizures on Facebook, and we wanted to create an expert line that truly is available 24/7. So we also have the support of regulation of this in terms of our medical licenses and all of those things. So when you're reaching out to other parents, it's a little bit dangerous to be giving advice. So what we want the norm to be now is tell anybody who's having issues to call this line. We are here 24/7. And the other barrier to this is that we really have had trouble getting providers to call the line. And we are working on trying to overcome that by educating providers at many different meetings about the existence of this line, but explaining to your providers that this is through an academic center and has a research focus, I think will help too. And we also have an email. So if you want to give us a call and you're not getting your provider to call us, anybody can email this and it is monitored. I'm going to go a little bit faster so I don't go over my time, but you can see that we have these detailed clinical pathways, and one of the things we're working on now is creating a website where providers can access that website and click through what's going on with the child in front of them to try to help them navigate how to best take care of individuals with Angelman syndrome. And this is going to be accessible on the World Wide Web to anyone. So this is pretty complicated. I will get it down to nuts and bolts, which is that during business hours, this is fully staffed by a nurse who will take a call from anyone. So she'll take a call from a parent, she'll take a call from a provider. After hours, we use the Children's Hospital Colorado infrastructure for an answering service to start, and their template is that they will only take calls from providers. So after hours, you can, if it's not a true emergency, although we try to monitor closely, you can email us. Or you can call, you will get connected to a parent line, and they are supposed to connect you to us. So I mentioned this already, but we're really trying to come up with clear standard of care practices to create those clinical pathways so that they can be available across the board. So even hopefully over the 3 years that this exists, it will continue to grow and we'll continue to have it available. But one thing that definitely will come out of this is some standard of care practices with some more evidence behind them. And so we are working on expanding services to include access to a speech and language therapist with AAC, a dietitian, and an education advocate who could even sit in on IEPs. And this is in partnership with the Angelman Syndrome Foundation. Hopefully this will come forward. But the other partnerships that we're continuing to build is that this really paved the way, and the support from FAST really paved the way to open this up as a standard of care potentially for all rare disorders. So a very innovative way of taking care of kids and making sure people can access care. So this is how you reach us. We have a 1-800 number. It's international. If anybody calls the 1-800 number, you will be immediately connected to any kind of interpreter. We've had Chuckese, we've had Japanese, Italian, so we pretty much, you can reach us no matter what language you speak or what's most comfortable for you. And then we also have this email that you can access as well. And so I wouldn't be able to do this without these amazing ladies. In particular, I want to thank Soraya, who's our nurse, who's been fantastic and very active and helpful to get things done quickly. And then I just want to say how excited we are to have this available, and we couldn't do it without FAST. Both the support from brainstorming how to make this work, but also for the generous funding that they've provided to us to make this possible. Thank you.
If there are any questions, we can answer maybe one or two, and then we'll save the rest for the panel.
Hi, Dr. Duis.
Hi there.
My question is, do you have any promotional materials, or I know that I got a business card from you once about this, that we can pass to all of our providers outside a clinic to help share the message?
Yes, definitely. So we have some flyers we can definitely distribute and make sure we get that to everyone. It's a good idea.
we can post them on the FAST website and Facebook page as well, so you can just print them out. So that would be easier if you want to forward them to people or print them out yourself and bring them to your appointments. Oh, I'm sorry.
In expanding your services, have you considered addressing some of the emotional health issues of not the families, but the Angelman syndrome individuals themselves? I have found over the years that Angelman syndrome not only impacts our families, but it has a tremendous emotional impact on the individuals with Angelman syndrome, frustration and anger, fear. When they have the seizures, because they don't know what's going on, just like it wouldn't impact anyone else, but since they can't communicate those feelings and don't understand their emotional needs, I think it's something that hasn't been addressed with these kids because they've got so many other things going on, but I think it's very important to help them somehow with their emotional distress that they have.
Absolutely, yeah, thank you for that comment. We already do that, so the providers who are available now can take questions about mental health, behavior, GI concerns, seizures, sleep, and sometimes all those things go together. But yeah, we are able to serve that need right now. Absolutely.
Sorry, I didn't even see you. Do you think you will be having maybe like speech pathologists added to this as well? Because we've been having issues trying to find a speech pathologist that can work with our son because we've been told by 2 different ones that they feel out of their depth.
Yeah, so a couple of resources for that. One is that our standard of care paper should be out any day now, and that does have some guidance for all aspects of Angelman syndrome. But that's part of the expanded services that we're working on, that someone could directly reach an expert speech and language pathologist who can help with AAC or any issues that come up with Angelman syndrome.